Welcome. Good to see everybody. We're here with Dr. Mark Shalek here in Plano, Texas, who is an expert in his field dealing with this thing, the ticker, the heart. Dr. Shalek, great to have you here.
Thanks, Gordon. Good to be here.
Now, you work with the core of people's lives, their heart.
Correct. I've been a cardiologist for 17 years now. I did my training in Atlanta, Georgia, at Emory University.
Okay.
And I do non-invasive cardiology, see a lot of patients for clinical consultations, do a lot of non-invasive testing on the heart, and try to keep my patients well so that they avoid the end results of heart disease, such as heart attack and stroke.
Okay. Now, we're dealing with athletes. So typically when you're thinking like as an athlete, then I'm in the best shape of my life. I'm young. I don't have any issues. I'm not older. So typically, some athletes think that this is something I don't need to worry about, but it really is not so much worry, but you need to be aware of certain things that might be going on inside your body.
Absolutely, there are a few entities, even in the young athlete's heart, that can be a dangerous problem. That even if you feel well, it's worthwhile having some sort of a screening test with your doctor. No doubt about that.
Now, the instances among like a cardiac arrest, a real major, I was looking at doing some research about athletes, and it's more football and basketball athletes, and more males than females, and more African Americans than even the normal population. So I'm tracking in all three of those.
Mm-hmm.
You know, as a former athlete,
Mm-hmm.
And so now I got a young kid that's working out, getting in shape, and thinks, man, I'm invincible, because you, as a great athlete, you get to the place where you think I can do anything at any time, but it really is a case that if you'll check certain things out, you might have some incidences of different things that may not go well for you.
Correct. We know what is devastating, Gordon, is a young athlete who has sudden cardiac death during athletic participation. And we've seen the stories in our local regions, wherever you happen to live, that if you're watching this video, and the stories that even make national acclaim.
Yeah.
There's always a handful of disasters nearly every year of some young athlete seemingly well who dies during participation. And that is an absolute disaster. About 85% of those are in men, 15% are in women. It turns out that football and basketball have the most of these events because those are the most participated sports in high school athletes. Okay. And in terms of the racial differences, I don't think anyone actually knows why that is, but it has been an observed finding. There are a few entities that usually cause sudden cardiac death amongst athletes. One of them is a process that's called hypertrophic cardiomyopathy. It's often abbreviated HCM.
Okay.
And in good old layman's terms, what it means is you have a thick heart muscle. So it doesn't mean the heart is not pumping strongly. In fact, the thickened heart often pumps more strongly than necessary. But if my fingers are the muscle itself, it's too thick, and that thickness can cause multiple kinds of problems, including electrical instability of your heart's electrical system, where your heart can have chaotic electrical activity and literally kill you on the spot without any warning. So it is important to be sure that you're not in the category of this hypertrophic cardiomyopathy, which again means a very thickened heart. There are other entities that put people, young athletes, at risk for sudden death. If you looked at all the causes of sudden cardiac death in young athletes, that entity that I just described is responsible for about a third of those deaths.
Okay.
So that's something we can screen for and possibly make a difference. Other abnormalities include congenital abnormalities of your arteries of your heart.
Yeah.
That's not blocked arteries. That's what you or I get at age 50.
Right.
That's not what an 18-year-old gets. They don't get blocked arteries. They were kind of put together funny by God, if you will.
Okay.
And there are a few electrical abnormalities that can be noted on an EKG that we know that are very rare, but can put young athletes at risk of sudden cardiac death.
Okay, so I'm an athlete. I'm getting ready for the season. I take my normal preseason physical that I have to take, have the doctor sign off. I go typically to either a multi-care center or something like that, and they're going in, they're going to weigh me, do my height and weight and all that stuff, and run me through, and you're typically in and out of there in about 15, 20 minutes. Is that going to be something that is going to detect if somebody has an issue and they're not talking about it?
Maybe, but maybe not, because some of these things have nothing to be detected. Let's talk about the hypertrophic cardiomyopathy, that thickened heart syndrome. Some patients have a heart murmur when the doctor listens to the chest with the stethoscope, but some do not. So you can miss things easily on just the physical. The more important part of that visit, pre-season, will be the discussion phase, what we call taking the history from the patient, where the doctor can ask the kinds of questions that would elicit the symptoms, even if the athlete's trying to underplay it. The doctor should hopefully be able to ask the right questions to look for those symptoms that maybe the athlete was blowing off, but the doctor takes seriously. The physical examination will be important. An EKG, I think, would be important. Hypertrophic cardiomyopathy has an abnormal EKG 90 to 95% of the time, even if the exam is normal. Okay, so that would be important to have done. It may not be mandatory, but I would recommend that be considered.
Are there symptoms that an athlete would have to say, man, I'm feeling woozy, or my knees hurt, or I don't particularly like, I don't have an appetite anymore? Is there anything that would give them some indication, maybe I need to get screened?
Okay, so there are. Great question. Number one, every athlete should see a physician before they start. Every high school athlete or college athlete, in my opinion, should see a physician for a good history and physical. And at that time, the doctor will ask you about the symptoms to exactly what you're asking me. If you have shortness of breath that's not explained by your activity, that surprises you by that activity, that could potentially be a problem. If you have chest discomfort, not necessarily just the word pain, but tightness, heaviness, pressure, discomfort, a squeezing feeling with activity, that's something you need to tell your doctor about. If you feel your heart racing rapidly, even though you're not doing anything to make it go rapidly, that should be a signal to get screened by your physician. Fatigue that's out of proportion to what you're doing. Okay, look, we all can get tired if we exert ourselves very, very vigorously. But if that fatigue is above what you think it should be, that can be a symptom to watch out for. And those are the things that you either volunteer to your doctor or will be asked of you when you see a doctor, even if you're not the kind of young athlete that wants to, tell your parents or tell your coaches how you're feeling. But those things I just went over are things that should be brought to the attention of your coach, your family, and your doctor.
Yeah, that's important stuff. Fatigue, shortness of breath, a tightness in your chest, any of those things that you're seeing or experiencing in your personal life, what you need to do is get it checked out. I mean, because really, even though the percentage might be small, we want to be safe and just have it checked. If it's nothing, it's nothing. But sometimes the cost factor and expense really kind of delays somebody from doing that. But your life is so valuable, and I think there's even programs are being started across the country to help mitigate some of that.
There are. So, and I'll get into that program in a minute, but I think what you said is important, because it's most likely going to be nothing if you have those symptoms. But you don't want to be the one who didn't say anything and it was something. You need to get these things checked out.